Billa. So what we're looking here is, certainly in terms of how consumers are engaging through the pandemic, how that has affected the market in terms of global wellness. You can see some of the numbers there in terms of the value of the market now at 4.75 trillion with a T. So massive amounts of growth. And what we're seeing is a lot of people out there who, especially in more developing countries where we're based, having a huge interest now in health, wellness, lifestyle changes, based on the recent circumstances that we've all been living through. I think when it comes to looking at how we monitor our health, there's been big changes in that as well. Even my mum, 75 years old, wears a Fitbit, tracks her steps every day. And we're seeing that across the countries that we work in, where people want to be aware of their health on a day-to-day basis. And technology has been a great way to do that. And obviously companies as well jumping onto that wellness bandwagon to attract people to their businesses as well. We've seen 75% of employers and even 33% of smaller companies which are running wellness programs, which can be anything to wellness days, to mental health days, to exercise programs, and everything in between. And I think one of the things that we can all relate to is feeling anxious, feeling stressed, feeling nervous. There's been lots of health implications that have come with the pandemic related to things that we never really thought about before, such as being alone, being secluded from companies, from teams, working independently, how to work from home. And a lot of that has caused this mental health struggle. And we see it especially in our younger generations, Gen Zs. We've had firsthand experience of working with new recruiters coming into the industry. And I'm sure experts out there listening now have experienced the same thing, where you're hiring people that you've never met, who are working in teams they've never interacted with in any way apart from on a Zoom call. And it's become the new normal for some of those people. So how do we fix that? How do we deal with that? Well, let's jump into our first question for the panel. So Nabila, if you could just move through. So here's our first question. So how has consumers' behavior towards wellness shifted during the pandemic? And what will this post-pandemic normal look like for the healthcare industry? So this is our first question. So I'll put this over to the panel. So in no particular order, who would like to come forward on this question?
I can take the first shot here, James, if that's fine with everybody.
Ian, fantastic. Over to you, Ian.
Yeah, so from my perspective, I'll mention two things. One is product, and next is people, right? So in terms of product, I think what we've learned as a whole during the last 2 years is our health is very important, right? And what I see happening now, and it's currently happening, and perhaps it's going to accelerate further in the future, is for companies to come up with more preventive medicine versus curative. Of course, curative medicines will still be there and still be researched, but a lot of focus has now gone to vitamins, for instance, even probiotics, making sure that we are ready for whatever illnesses there is, not just during this pandemic, right? And then secondly, I think in terms of people and in terms of working, Sanofi has been started even prior to the pandemic. We were already doing some hybrid work, and I think that's going to continue for the healthcare industry in general. And it really makes sense, for instance, for a country like the Philippines, where traffic is very bad, one of the worst in the world. Fuel prices are now sky high. So I think it really makes sense in terms of engaging with our HCPs, for instance, and even our trade customers, in terms of working from home, working outside the office, or a mixture of it. So I think moving forward, that's going to be what's going to happen. That's what's going to happen in the healthcare industry.
Thanks, Ian. Yeah, I fully agree. I think in terms of the preventative side of things, looking at the type of advice we get out there, just taking vitamin D, taking magnesium, taking different, having a healthier lifestyle. great way to build your immune system. Yeah, I really agree with that. Some fantastic points there. Thanks, Ian. Any of the other panelists would like to come in on question number 1?
Sure, I'll jump in.
Hey, Anjie.
Yeah, hi. Okay, so in my opinion, I think that we have to look at it in 2 different ways in terms of how consumer behavior has changed, at least from the perspective where I've worked with people. I think the coronavirus has brought about a lot of concern in terms of what people can do in terms of preemptive health. Okay, so yes, the vitamins are there. They're trying to take care of themselves. There's a lot more focus on what disease they could develop, which is coming through at much more affordable rates thanks to genetic testing. But at the same time, there's one more area that we need to look at is the strain in the healthcare system almost worldwide as a result of COVID. People have been forced to take care of themselves because a lot of surgeries have been delayed. Doctors' appointments have been delayed. There's a rising staff turnover. There's so much competition to get qualified health workers into the system. So in a way, people are trying to take care of their health, but because there's so much information out there and a lot more wrong rather than right, I think we also need to take care and look at the effects of putting health in personal hands without proper information. So there's a lot of people who are coming out of this and saying, I went ahead and I tried to take care of myself. I've been taking certain vitamins, I've been taking certain medications, and lo and behold, they don't realize the deep problems they have in their health that are probably trying to crop up now. And as a result of what they've done to take care of their health, they have a slew of other problems to take care of. Secondly, that I see is that there's a fear within those people that we're talking to, at least from the consumer base that we look at, in terms of what's ahead. How are we going to take care of ourselves if there's another pandemic and we don't have access to healthcare the way we used to? There's even talk about what we have today as monkeypox, and some people starting to question as to whether this was another scientific experiment. So I think what we also need to look at is consumer behavior that is based on the changes that are happening in the world, thanks to technology, thanks to the forced changes that came about because we didn't have ready access to healthcare because of the pandemic. And the other side is the fear that's built up. Okay, so how to balance that and actually give consumers or our customer base the appropriate care and the appropriate knowledge for them to go forward in a proper manner.
Thanks, Anjie. Yeah, that's interesting to hear that people looking after their health in one way can affect their health in another. So you need to dig into it and have the full picture. Yeah, a lot of people try and diagnose and look after themselves, and that access to doctors, and certainly in, I would argue Jakarta's up there with the Philippines in terms of traffic and that ability to be able to use these new online platforms to speak to medical professionals, to get a second opinion, and to get the correct advice is very, very important. And yet the strain on the healthcare as well is another fantastic point. I think, my family across the UK have seen that with the NHS, and the amount of strain and pressure that they were put under with long hours, massive amounts of people coming in. And we've all seen the pictures of overflowing hospitals in Southeast Asia. So how businesses now deal with that, and how they, look at, hopefully the monkeypox is not the next pandemic straight away, but how do we prepare for the next one? Yeah, fantastic points there. Thanks a lot, Anjie.
And Jim, I can
add up.
Yes, I can add up a little bit about the consumer behavior and the action. Yes, because somehow like after the pandemic, we also have a surveys from the market, and we can realize that somehow like in the past, the doctor really have something, no problem to happy to interact with the medical representative, but now somehow after the COVID, there's something because of maybe long time social distancing and the mask wearing. So now the survey show that instead of the med rep for top one, further interact with the endeavory, the scientific or the medical information, product information. Now the doctor want to receive from the message from the email, and then from that they also don't want to go to maybe travel somewhere to attend a lot of conference or scientific, and instead of that they want to prefer at home and can receive that or join online or virtual meeting team. So during the pandemic, we had no choice because we just have a need to speed up and how to something like still ensure the operation and the manage the business runs. And that's why we move a lot of, we enhance a lot of technology. Yeah, so this is something more and more the access with the technology and in the healthcare, and especially for all our customers in this case include both the doctor and the patient as well, or even the healthy subjects, because we can see that the chain of the enhanced technology application in the healthcare.
Yeah, great points. I think, you know, definitely one thing that the pandemic has created is a massive amount of data. And so what do we do with that data? How do we analyze that data? How do we use that to, you know, to solve issues that we missed this time, or to make ourselves better at treating the next one? And also with that massive amount of information you see in the news is this proliferation of fake news. Or what do we need? You know, you hear about if you wear this necklace, then, you know, it will keep COVID